someone's gender identity is their sense of being male or female. For most of us, that's something that we're born with and never troubles us, and there are a proportion of individuals in the population, quite small but quite important, where their sense of maleness or femaleness doesn't match the body they were born in. A proportion of people will be so disturbed by that and so upset that they're going to feel significantly better and do better in their lives if they have treatment with hormones and ultimately possibly surgery. The Trust, as anywhere else in society, is obliged to treat people fairly and decently. If somebody was born male and is living their life as a woman, whether or not they're taking hormones, and definitely whether or not they've had any kind of surgery, if they're living their life as a woman, then that is how they should be treated, because that's how they are in day-to-day life.
I dress as female 24/7. I live as female. Everything to do with me is female. To actually hear someone make very basic mistakes, whether it be pronouns or whether it be asking us to use the wrong changing room or something like that, it's devastating. I don't want to hear people use the pronouns him or he. That was my past. I want to hear people express their sentiment towards me as Miss or she or even Vicky. This is a very important thing when dealing with transgendered people.
In the past, we have had difficulties where a patient who is transitioning has needed hospital admission, and that's caused a lot of confusion and anxiety around staff of them not knowing which ward to admit that patient to. Sometimes there can be difficulties. Other patients may realise that one of the patients on the ward is transitioning. That can cause a challenge because the patients themselves may be discriminatory and they themselves may be unwell. However, staff must manage this in the same way as they would any other form of discrimination on a ward. Above all, that patient must be supported and respected on the ward.
I'm not.
If somebody is living as a female, then they should be using the women's toilets, and vice versa. If they're living as male, they should use the male toilets. What sometimes has happened is where people have been directed to the disabled toilet or to the unisex toilet, but not allowed to use the specific gender toilet. And this isn't acceptable, and this is discriminatory. Sometimes staff are actually concerned that they may be breaking the rules when they discuss the patient's previous gender, which is not generally accepted. However, it may be important for physical health or sexual health to actually discuss those areas. And the best way to actually do that is to be led by the patient, to use the care plan, get them to describe what they might feel is appropriate for them, and just try and guide them. And that way you'll be entering into a genuine discussion with the patient and you won't be going wrong. There is trust guidance that refers to a lot of these issues, and it should be consulted if there are any concerns regarding admission or anything to do with managing or working with patients or staff.
There's a handy guide that covers most circumstances that people might meet on the Trust intranet already, but if things aren't clear from that, then the best thing to do is to ring up for advice, for the clinic operates between 9 and 5 every day of the working week, so there should be somebody always able to answer the question. I hope that the staff in the Trust, wherever they might encounter such patients, would treat them exactly as they would treat any other patients that the Trust would encounter, with fairness, dignity, and offering them a high standard of service.